What's up, everybody? I hope you're doing good. Thank you very much for stopping by. You are very much appreciated. It's nice to see you coming back. It's such a nice feeling knowing that you're coming back to check on your brother, because I got some good news for you. Okay, so I see you from South Africa. Thank you so much. I notice you. I see you from Kenya. Thank you very much. Ghana, Zambia, Zimbabwe, Malawi. Thank you so much. Nigeria, the UK. I see you, our brothers over there. People from the Caribbeans. Thank you so much. From the USA and all over the place. Sudan, Ethiopia, Somalia. I see you. So we most of the time talk about geopolitics subject. We share our views and we contribute to the best of our ability. Today we're going to talk about something very interesting. Did you know that black pregnant mothers in America run the risk of more than any other race? Did you know that? Were you informed? I remember when we were younger, we used to believe that by sending your pregnant wife to the United States, you're getting good chances of having a very beautiful birth and good experience giving birth. That's not the reality. The reality is more drastic than you can imagine. Let's watch this so we can understand. Let's go.
All right, thank you, Dennis. We're going to check back with you shortly. New here at 6 tonight, some call it the silent tragedy, the number of women in America dying from pregnancy or childbirth complications.
ABC Action News reporter J.J. Burton finds out black mothers and their babies are at the center of this growing problem.
The numbers tell the story. 17 out of 100,000 American mothers are dying yearly. And that's more than double that of women in other developed countries. See for yourself.
So a lot of Americans, pregnant women in America, die more than anywhere else in the world. That is scary.
We need to do better.
But for black mothers, advocates say better has to start right now. And black mothers die at 3 to 4 times the rate of white mothers.
What? Black mothers die 3 to 4 times the rate of white mothers. 3 to 4 times. Unbelievable.
And the CDC describes it as one of the widest racial disparities in women's health. For example, a black woman is 22% more likely to die from heart disease than a white woman, 71% more likely to die from cervical cancer, and 243% more likely to die from pregnancy or childbirth-related causes.
243% more likely to die than a white mother from pregnancy. I didn't know pregnancy was a disease. Like, I'm very surprised. I thought it was a pleasant experience. I know it's, the pain and stuff, the screaming and everything. But in Africa, most of the time, it's a beautiful event, beautiful moment, lovely experience. 243%? No.
And the numbers aren't better for their babies.
If we look at black babies, they die at a higher rate than white babies.
A local OBGYN, Sharon Ingram, and I spent about 2 hours on Zoom talking about this growing crisis. For her, it's personal for 2 reasons. She's black. And this is a picture of Dr. Ingram holding her newborn baby boy, AJ, the day before he died.
I actually had a child pass away from SIDS at 4 months of age, and he would have been 21 years old today.
And she was in med school at the time.
Of course, at that time, it was devastating.
SIDS is sudden infant death syndrome.
Sudden infant death syndrome. Wow. So they have a name for baby that just go with no reason. Black babies. Okay.
Dr. Ingram says SIDS is one factor on a very long and growing list of factors contributing to the increasing maternal mortality rate in America.
So there are many factors. There is practitioners factor. So practitioners, people in healthcare make mistake. Social economic status, education, hospital-driven issues, hospital problems, patient-driven. Wow, interesting.
Add to that racism within the healthcare system and implicit biases against black and brown women, and you have the reason so many black mothers and so many black babies are dying. St. John Progressive Missionary Baptist Church is in the middle of a neighborhood with one of the highest black infant and maternal mortality rates in the county. And the church partnered with the Healthy Start Coalition of Hillsborough County to secure a grant specifically to help local black mothers.
We developed a partnership with them that we could reach out to individuals in these zip codes that our churches are located to have access to prenatal health care. And that's been going on for 20 years.
And still, those numbers are growing. Dr. Ingram says the best way for doctors to help black women, be aware of your implicit or unconscious biases. Treat all of your patients with the same respect. Ask them all questions. Learn about different races and cultures. And listen to the patient.
Listen to the patient. So basically, they do not listen to the black patients. When you go to an hospital in the USA and you're pregnant as a black woman, they're not going to listen to you. Yeah, they're not going to listen to you. Not the way they listen to any other race, or especially white race. That's the reality of thousands of mothers. So they want them to be aware of the biases that are threading. They want them to treat all patients the same, because they don't. They don't treat all patients the same. They want you to ask questions. They want them to learn different races and cultures. So basically in America, they feel like black mothers have a higher pain threshold. So meaning black women can contain pain more than any other race. Yeah. They don't give them painkillers as easy as anybody else. There've been reports where people have been asking, crying in pain, and they waited for an hour, 2 hours before they were administered any sort of painkillers because they're black. It feels scary.
The biggest thing is looking at every patient for what their risk is, what they're bringing to the table, looking at their medical conditions.
On top of that, Dr. Carolina Hernandez says we need to start tackling racism within the healthcare system.
There's a lot of emphasis politically placed on abortion and whether or not women should have the abortion, but there's not a lot of emphasis placed on helping minority women even get pregnant and conceive or be able to carry a child to full term without the woman being in danger or the child being in danger.
Wow, do you hear that? There's a lot of emphasis on how to deal with yourself when you need to have an abortion. So there's a lot of premises where you can go and have an abortion, a lot of documentation on how you're going to proceed in order to have a successful abortion. But there isn't a lot of work being done on how to have black women being pregnant and delivering in total safety. So they are working very hard for you to not have those babies. They've invested enough for that. They're not invested in you being safe. That's very scary.
From the government, I think that they need to put emphasis in reaching out, and so that minority women have access at least.
Currently, there's a bill in Congress called the Health for Moms Act.
Patients on Medicaid will have insurance for the whole year after they deliver. Currently, if a patient applies for emergency Medicaid, they're only covered for 60 days after they deliver. But that mortality rate goes up to the whole year.
Florida House Speaker, Republican Chris Browse, is pushing for a similar bill here in the state, and it has bipartisan support.
In America, healthcare costs a lot of money. Procedures like this could cost a lot of money. And unfortunately, people get insurance that are very limited, up to 90 days. But these dangers occur even after 90 days. And now they're trying to fight to get people being registered and being covered longer. Fellas, this is very sad. America, when we were growing up, we saw America as a big brother, I know in most African countries, a lot of Africans have always, their dream is to go to America. You know that, right? You know that. A lot of Africans dream of going to America, visiting, not necessarily visiting, living in America. They will do a lot of things for that. But it's scary. The first time I was in the US, I was shocked because America was not what I expected. I expected it to be a beautiful, lovely, well-maintained, well-kept place. After all, who am I to be blamed? Because after all, if you look at Rambo was American, Batman is American, Superman is American, Spider-Man is American, Flashman is American. All these people are American, and you think America is such a beautiful, lovely, amazing, untouched, unbothered, very strong place. But the reality is very drastic, fellas, and shocking sometimes. You see the number of people in the street of New York, homeless people, you're going to be shocked. I'm telling you, you go to Detroit, you see Detroit, you're going to be shocked. You think you're in some corner, lost corner of Africa, poor corner of Africa. That's what I'm saying. Absolutely nothing to do with what you see on TV. That's the reality. And when you speak to some Americans, you are shocked with the level of ignorance. And I'm not saying everybody, but some people, when you speak to them, you're shocked. Like, whoa, because we were bred to believe Americans were the greatest people in the world. Now, it's very sad to see a rich country like the United States of America completely dishonor, let me put it that way, completely disregard the health of a specific group of people of society. Now, this raises a lot of questions. Is this premeditated? Is this done on purpose so that you guys don't have more and a lot of babies? Perhaps. I don't know. I'm just saying. They're asking you to go have an abortion very easily. You can do that very quickly. No difficulty, no issues. There's a lot of investment into that. Not enough investment into you being safe during pregnancy and your baby surviving. Now, what's scary here, it's not just the women that are in danger, the babies too. My question is, are you going to tell me that all these white doctors, all of them just ignorant? All of them just don't understand? How come these things just repeat themselves in very similar ways in many different places, many different hospitals, in different states with the same people?
We went in for what was supposed to be a routine scheduled C-section on what was supposed to be the happiest day of our lives, and we walked right into what was a nightmare. 6 o'clock, no CT scan. She's beginning to become pale. She's in extreme pain. 7 o'clock comes, 8 o'clock comes, no CT scan. I'm begging, I'm pleading the staff to do something. And around 9 o'clock, as I continue to plead for my wife's life, the staff at Cedars-Sinai Medical Center tells me, "Sir, your wife just isn't a priority right now."
Kira Johnson was finally taken into surgery at 12:30 in the morning, where doctors found over 3 liters of blood in her abdomen. She did not survive.
There's no statistic that can quantify what it's like to tell an 18-month-old that his mother's never coming home. My wife deserved better. Women all over this country deserve better.
I don't know. Let me know how you feel about this, because I'm very shocked and very disappointed. But in the meantime, the USA is a country that goes across the world, try to preach people being nice, being fair with other people, respecting democracy and treating people, whatever that is, respecting gender and colors and all that. But in the meantime, what's happening in the state it's disappointing, especially for our communities, for the black people. It's just very sad. Now, what they're asking people to do is, as a black mother, when you go to an hospital, you must ask the maximum questions as possible. You need to know everything about everything. You need to ask, who is your physician? Who is he? Who has he worked with before? What kind of experience? What can you expect? What are all the steps? You need to be equipped enough and have support of people who can agree on things that can be done onto you while you're in conscience. It's very scary and very sad. How come they don't make the same mistakes with any other race? If the mistakes is mistakes, a mistake can be done to anybody else. If a mistake is repeated to just a specific group of people, is that really a mistake? Big question. Let me know how you feel about this. Please don't go without leaving your comment. We want to read from you, learn from you, so we can build each other together. God bless.